Excuse me, I was hoping you could help me. I'm not feeling well at all, and I've been wandering around the cold medicine aisle for a while now. There are so many options on the shelf, and honestly, I'm not sure which one is right for me. I think I have a cold, but I don't really know where to start. Is this a good place to ask for advice, or should I go somewhere else?
Of course, you've come to exactly the right place. That's what I'm here for. Don't worry about all those options on the shelf. That's why we have a consultation counter. I'm Sandra, the pharmacist on duty today. I'd be happy to help you find something that's right for your situation. Before I can make a recommendation, though, I just need to ask you a few questions. So how long have you been feeling this way? Did it start today, or has it been going on for a little while?
It started yesterday morning, so about a day and a half now. When I woke up yesterday, I already had a runny nose and my throat felt a little scratchy. As the day went on, I started to feel more and more congested, like really blocked up, And then by last night, I noticed I had a slight fever as well. I took my temperature and it was around 99.5 degrees. I was hoping it would pass overnight, but I still feel pretty rough this morning.
I see. Thank you for giving me all that detail. It's really helpful. A runny nose, congestion, a sore or scratchy throat, and a mild fever. That does sound like the beginning of a cold. I want to make sure I understand your symptoms fully so I can point you to the best product. Are you coughing at all? Sometimes a cold comes with a dry cough or a tickle in the throat, and that can change which medicine works best. Or is it mainly the congestion and the runny nose that are bothering you the most right now?
There's a little bit of a cough, but honestly, it's not too bad. I'd say it's more of a minor annoyance than a real problem. The biggest issue is the congestion. I feel really blocked up and my head feels super heavy, like there's pressure behind my eyes and forehead. It's hard to concentrate at work, and I just feel kind of foggy all the time. The runny nose is also pretty constant. I've been going through tissues like crazy. So yeah, mostly the head and nose area is what's getting to me.
That really does sound like what we call a classic head cold, which is exactly what the name suggests. All that pressure and congestion concentrated in your head and nasal passages. Now, before I recommend anything, I need to ask a couple of important health questions. This is completely standard. I ask every customer the same things. Do you have any known allergies to medications? For example, some people are allergic to aspirin or certain antihistamines. And are you currently taking anything else on a regular basis? Any vitamins, supplements, or other medicines I should know about?
No allergies that I know of. Nothing has ever caused a reaction for me before. As for other medicines, the only thing I take regularly is a vitamin D supplement, just one capsule in the morning. That's about it. Nothing prescription, no ongoing treatments or anything like that. I'm generally pretty healthy, so I don't usually take much of anything. I tend to avoid going to the doctor for minor things like colds. I'd rather just pick something up at the pharmacy and deal with it at home if I can.
Good to know. No prescription medications, and just a vitamin D supplement. That definitely makes things easier and means we have a wider range of options available to you. I have one more important question before I make my recommendation. Do you have any history of high blood pressure or any heart conditions? I know that might seem like an odd question for a cold, but the reason I ask is that some of the most effective cold medicines contain a type of ingredient called a decongestant. And decongestants can actually raise blood pressure in some people. So it's really important that we check before recommending them.
Oh, I didn't know that. That's actually really interesting. No, my blood pressure is totally fine as far as I know. I had a checkup a few months ago, and the doctor said everything looked normal. No heart conditions either. But now I'm curious. Why exactly does a decongestant affect blood pressure? I always thought those medicines were just for unblocking your nose. I never really thought about them having that kind of effect on the rest of your body. Can you explain that a little bit?
That's a great question, and I love that you're curious about it. A decongestant works by narrowing the blood vessels in your nasal passages, which reduces the swelling and helps you breathe more easily. But here's the thing. It doesn't just narrow vessels in your nose. It can affect blood vessels throughout your whole body, which can cause your overall blood pressure to go up temporarily. For most healthy people, this isn't a big concern, but for someone who already has high blood pressure, it could be risky. Since your blood pressure is fine, we don't need to worry about that, and you have access to the most effective products. That's good news.
Ah, that makes a lot of sense now. I never would have thought about that on my own. That's exactly why it's helpful to talk to a pharmacist instead of just grabbing something off the shelf randomly. So, based on everything I've told you, what would you actually recommend for me? I want something that's going to tackle as many of my symptoms as possible, because dealing with the runny nose, the congestion, the sore throat, and the mild fever all separately sounds exhausting. Is there one product that covers all of that?
Yes, absolutely, and that's exactly the kind of product I'm going to point you toward. What you want is what we call a multi-symptom cold and flu relief medicine. The word multi-symptom means it's designed to treat several different symptoms all at the same time rather than just one. A product like Dayquil, for example, is a very popular choice. It typically contains a decongestant for that blocked up feeling, a fever reducer, and pain reliever for your mild fever and sore throat, and a cough suppressant for that minor cough you mentioned. One dose can cover all your main symptoms at once, which is really convenient, especially when you're trying to function at work.
That sounds perfect. Exactly what I was hoping for. I love the idea of just taking one thing instead of mixing a bunch of different products together. Okay, so how often do I actually take it? And is there anything important I should be careful about while I'm using it? I want to make sure I'm following the instructions correctly, because sometimes I feel like the writing on those boxes is so small and complicated that it's hard to understand. What's the most important information I need to know about dosage and how to take it safely?
Great question about dosage. It's really important to get this right. The standard instructions for a product like this are to take it every 4 hours as needed. The phrase "as needed" means you only take it when your symptoms are bothering you, not necessarily on a strict schedule. However, and this is very important, you must not exceed 4 doses in any 24-hour period. Do not exceed is the key phrase to remember, and it means don't go over that limit no matter what, even if you feel like it's not working fast enough. Also, I always recommend taking it with a little food or a full glass of water to avoid an upset stomach. And please drink plenty of fluids throughout the day. Staying hydrated genuinely helps your body recover faster.
Okay, so every 4 hours as needed, and no more than 4 doses in 24 hours. Got it. I'll definitely take it with food because my stomach can be a little sensitive sometimes. And yes, I've heard that staying hydrated is important when you're sick. I'll make sure to drink more water today. I do have one more question about the daytime version, though. What about at night? Last night was really rough because I was so stuffed up that I couldn't breathe properly through my nose, and it made it almost impossible to fall asleep. Is there a nighttime version I can take to help with that?
Yes, there absolutely is, and it sounds like you could really benefit from it. For nighttime, there's a product called NyQuil, which is basically the nighttime version of DayQuil. The key difference is that the nighttime formula contains an antihistamine. That's a type of medication that helps dry up your runny nose and also causes drowsiness, which makes it much easier to fall asleep when you're feeling blocked up. Now, the important thing to understand is that the drowsy effect is intentional in the nighttime version, but it does mean you should only take it right before you go to bed. Please don't take it during the day, and definitely do not drive or operate any machinery after taking it, because it will make you feel quite sleepy.
Oh, interesting. So the nighttime version actually uses a different type of ingredient to help you sleep. That's smart. I didn't realize there was that much of a difference between daytime and nighttime cold medicines. I'll make sure I only take the nighttime one right before bed. I definitely don't want to feel drowsy at work or while I'm driving home. Actually, speaking of things to watch out for, are there any warning signs I should be aware of? Like, at what point should I stop relying on over-the-counter medicine and actually go see a doctor? I want to know when a cold becomes something more serious that needs professional attention.
That is such a smart question, and I'm really glad you asked. A lot of people don't think to ask that, but it's genuinely important. Most colds do clear up on their own within about 7 to 10 days, meaning they go away naturally without needing a doctor. But there are some specific warning signs that mean you should seek medical attention right away. First, if your fever goes above 103 degrees Fahrenheit, that's a red flag. Second, if your symptoms get significantly worse after a few days instead of gradually improving. Third, and most urgently, if you develop chest pain, shortness of breath, or difficulty breathing, please go to a doctor or urgent care immediately. Those symptoms could indicate something more serious than a common cold.
Thank you. That's really useful to know. I'll keep an eye on those things, especially the fever. Right now it's only around 99 or 100, so it sounds like I'm still well within the normal range for a cold. I feel a lot more confident now that I know what to take and what to watch out for. But I do have one more question, if that's okay. Is there anything else you'd suggest for the sore throat specifically? That scratchy feeling is actually one of the most annoying parts right now. It makes it uncomfortable to talk and even to swallow. Are there any products or home remedies that can help with that particular symptom?
Absolutely. Let's talk about that sore throat. One of the easiest things you can pick up here is throat lozenges. These are small tablets. Sometimes they look like hard candy that you dissolve slowly in your mouth, and they help to soothe the irritation in your throat. Soothe means to calm and relieve the discomfort. Some lozenges also contain a mild numbing agent that can temporarily reduce the painful sensation. Look for brands like Halls or Cepacol right here in the aisle. And on the home remedy side of things, which means natural things you can do at home without any medicine, Warm tea with honey is genuinely one of the best options. The warmth helps relax the throat muscles, and the honey coats the throat and reduces irritation. It's simple, but it really works.
Oh, I actually love honey tea. I'll definitely make some of that when I get home. It's good to know that a home remedy like that can actually be effective, and it's not just an old wives' tale. What about the congestion? Is there anything I can use specifically for that, aside from the multi-symptom medicine? Sometimes those medicines take a little while to kick in, and I was wondering if there's something more immediate that can help me breathe through my nose while I'm waiting for the main medicine to work.
Yes, great thinking. And there is a perfect option for that. I'd recommend trying a saline nasal spray. Saline means it's made with a saltwater solution, and it works by gently rinsing out your nasal passages and reducing the inflammation that causes that blocked up feeling. The best part is that it has absolutely no side effects. It's completely safe to use as often as you need, even multiple times a day. It doesn't contain any medicine, so it won't interact with anything else you're taking, and it won't raise your blood pressure or make you drowsy. You can use it before taking your cold medicine or any time throughout the day when you feel particularly stuffy. It provides pretty fast, immediate relief.
That sounds amazing. No side effects at all? I'll definitely grab one of those. I like the idea of having something I can use anytime without worrying about overdoing it or having a reaction. Can I ask, does the salt water actually do something medically, or is it more of a comfort thing? I want to understand how it works so I can explain it if someone asks me. It's interesting that something as simple as salt water can help with congestion. I wouldn't have guessed that on my own.
It actually does have a real physiological effect, not just a comfort effect. Good question. When your nasal passages are congested, part of what's happening is that the tissues are swollen and irritated, and there can be a buildup of mucus and irritants, like bacteria or allergens sitting in there. The saline solution helps in two ways. First, the rinsing action physically flushes out some of that mucus and those irritants. Second, the salt in the solution helps draw excess fluid out of the swollen tissue through a process called osmosis, which reduces the swelling and opens up the airway. It's beautifully simple, isn't it? No chemicals, no drugs, just physics and chemistry working together. That's why doctors and pharmacists recommend it so consistently.
Wow, I love that explanation. It actually makes total sense when you put it that way. I had no idea there was real science behind something so simple. Okay, I think I'm feeling a lot more informed now. Let me just make sure I have everything straight in my head. I'm going to get the daytime multi-symptom medicine, the nighttime formula, some throat lozenges, and the saline nasal spray. That feels like a really complete plan. Is there anything else I should think about while I'm recovering at home? Like, are there foods I should avoid or things I should do or not do to help myself get better faster?
You've got a great list. And yes, there are a few lifestyle things that can really make a difference in how quickly you recover. The most important one is rest. And I mean genuinely resting, not just watching TV on the couch while also checking your emails. Your immune system does its best work when your body is not under stress, so actual sleep and downtime is really valuable. On the food side, there's actually some good evidence that chicken soup can help. The warm liquid is soothing for the throat and keeps you hydrated, and some research suggests the broth may have mild anti-inflammatory properties. I'd also avoid alcohol completely while you're sick, as it dehydrates you and can interfere with your immune response. And of course, keep washing your hands frequently so you don't spread it to others.
Chicken soup. My grandmother always made me that when I was sick as a kid, and now you're telling me it's actually backed by science. I love that. And you're right about the rest. I have a tendency to push through and keep working even when I'm not feeling well, but I think this time I might actually take it easy for a day. I've been so congested and foggy that I'm probably not very productive anyway. One thing I wanted to ask, what about vitamin C? I've heard a lot of people say you should load up on vitamin C when you have a cold. Is that actually effective, or is it more of a myth?
Ah, the vitamin C question. That's one of the most common questions I get, and the answer is a little nuanced. The research on vitamin C and colds is actually pretty mixed. Taking vitamin C before you get sick as a regular supplement may slightly reduce how often you catch colds and how long they last when you do get one. But the evidence that megadosing vitamin C once you already have a cold will dramatically speed up your recovery is not very strong. That said, it's generally safe to take and won't cause any harm. If you're already taking vitamin D, you might consider adding vitamin C to your routine going forward as a preventive measure. Just don't expect it to be a miracle cure once symptoms have already started. Eating some citrus fruit or vegetables is a great natural source as well.
That's really good to know. I appreciate you giving me the honest, nuanced answer rather than just saying yes or no. It's helpful to understand the difference between what actually works and what's more of a popular belief. I do want to ask about one more scenario. What if I take all of this medicine and after, say, 3 or 4 days, I'm not feeling any better? Like, what if the symptoms just stay the same or get worse? At what point do I need to accept that this is more than just a regular cold and seek actual medical care? I want to be realistic about the timeline.
That's a very wise and realistic question to ask. Here's a practical guideline I like to give people. In the first 2 to 3 days, you'd typically expect your symptoms to be at their worst. Lots of congestion, runny nose, maybe that mild fever. The medicine will help manage those symptoms, but it won't cure the cold. From around day 4 onward, you should start to see gradual improvement. The congestion slowly clearing, the fever going away, the sore throat getting less painful. If instead you notice that things are getting significantly worse, the fever is climbing rather than dropping, your cough is becoming deep and productive, you feel pressure or pain in your sinuses or ears, those could be signs of a secondary infection like sinusitis or an ear infection. Those secondary infections do need a prescription antibiotic, so that's when you'd want to see a doctor. Don't wait too long if you have real concerns.
Secondary infections. I hadn't thought about that possibility. So the original cold might clear up, but it can sometimes leave you vulnerable to something else. That's a bit concerning, but at least now I know what to look for. I'll definitely keep an eye on how my symptoms are evolving over the next few days. I've actually learned so much from this conversation. I came in here just looking for a box off the shelf, and instead I feel like I've had a mini health education. Is there a specific type of thermometer or any other basic health tools you'd recommend I have at home for situations like this? Since I apparently don't have great monitoring habits.
I love that question. It shows you're thinking proactively about your health, which is great. For monitoring a fever at home, a digital thermometer is absolutely essential, and they're very affordable, usually just $5 to $10. Make sure it's one you can use orally or under the arm for the most accurate reading. I'd also suggest keeping a basic over-the-counter pain reliever and fever reducer at home at all times, like acetaminophen or ibuprofen, since those are useful for so many things beyond just colds, headaches, minor aches, and of course fever management. A good thermometer plus a reliable pain reliever are honestly the two most important items in any home medicine cabinet. Having them ready means you're not rushing to the pharmacy feeling terrible at midnight when something comes up.
You know what? I don't actually own a thermometer, which is embarrassing, given that I just had to guess about my fever last night. I should definitely grab one while I'm here today. I also don't have acetaminophen at home. I usually just go without when I have a headache because I don't want to take medicine unnecessarily. But you're right that it makes sense to have it on hand for situations like this. Actually, now that you mention it, should I be taking acetaminophen separately for this cold, or does the multi-symptom Dayquil already contain it? I don't want to accidentally double up on the same ingredient.
Oh, that is an excellent and very important question. I'm so glad you asked that, because a lot of people make this mistake without realizing it. Yes, Dayquil and most multi-symptom cold medicines do already contain acetaminophen as one of their active ingredients. It's there specifically to help with the fever and sore throat pain. So you absolutely should not take additional acetaminophen on top of it, because taking too much acetaminophen can actually cause serious liver damage, even though it seems harmless. This is one of the most common accidental medication errors people make. Always read the active ingredients list on the label before combining any medicines. If you need extra pain relief beyond what the cold medicine provides, you could take ibuprofen instead. That's a different type of pain reliever that works through a different mechanism and won't cause that same overlap.
Oh wow, I genuinely didn't know that. I had no idea that Dayquil already had acetaminophen in it. I absolutely would have taken both without thinking twice, so thank you for catching that. This is a great example of why it's so important to actually talk to a pharmacist instead of just grabbing things off the shelf. I feel like I would have made at least 2 or 3 mistakes today if I hadn't come to talk to you. Wrong product, wrong dosage combinations. It's making me think I should read medicine labels more carefully in general. Is that something you recommend people do? And is there a specific part of the label I should pay the most attention to?
Reading the label is absolutely something I recommend. It's one of the most important habits you can develop for your own safety. And yes, there are specific parts to focus on. First, always check the active ingredients section. That tells you exactly what medicines are in the product and at what strength. Second, look at the dosage instructions or drug facts section, which tells you how much to take and how often. Third, check the warnings section. This is where you'll find information about who should avoid the product, what drug interactions to watch out for, and when to stop using it. The label is essentially a mini instruction manual for the medicine. It can feel like a lot of small text, but those 3 sections are the most critical. If you ever have any doubt about what anything on the label means, please just come back and ask us. That's exactly what we're here for.
Active ingredients, dosage instructions, and warnings. Got it. I'm going to make it a habit from now on. I think in the past I've just kind of skimmed the label or not read it at all, which I now realize is not a great approach. Okay, I think I have a really clear plan now. Daytime multi-symptom medicine, nighttime formula with the antihistamine for sleep, throat lozenges, a saline nasal spray, a digital thermometer, and I'll grab some honey while I'm at the grocery store later for tea. Before I go, I just want to ask, is there a general wellness tip you give to people who seem to keep getting colds? Because this is probably the third or fourth time I've had one this year. I wonder if there's something I could do differently.
I love that you're thinking about prevention as well as treatment. That's a really mature and proactive approach to your health. Getting sick multiple times a year is definitely worth looking at. The most evidence-based tips for preventing frequent colds are: number 1, hand washing. I can't emphasize this enough. Most cold viruses spread through contact with surfaces and then touching your face, and regular thorough hand washing breaks that chain. Number 2 is sleep. There's really strong research showing that people who sleep fewer than 7 hours a night are significantly more susceptible to catching colds. Even just an extra hour of sleep per night can make a measurable difference to your immune function. Number 3 is managing stress. Chronic stress suppresses your immune system in a very real and measurable way. If you're working long hours under a lot of pressure, your body's defenses go down. Worth reflecting on.
Honestly, all three of those are things I could definitely work on. I probably don't sleep enough. I tend to stay up late even when I have to be at work early, and I know that's not ideal. And yes, work has been pretty stressful lately, which might explain why I keep getting sick. The hand washing I think I'm okay on, but the sleep and stress management are definitely areas to improve. It's interesting how getting colds is connected to all those bigger lifestyle factors. I always just thought it was bad luck when I caught one. Thank you so much for all of this information. You've been incredibly thorough and patient with all my questions. I really appreciate it.
It's genuinely my pleasure. This is the part of my job I enjoy most. It's not just about handing someone a box of medicine. It's about helping people understand their health so they can make good decisions. And you asked wonderful questions today. A lot of customers just come in and grab something quickly, but taking the time to really understand what you're taking and why makes such a difference. You're going to recover much more comfortably because of it. Don't forget, once you get home and read the labels on what you've bought, if anything is confusing or if a question comes to mind, you are always welcome to call the pharmacy. We're available by phone during business hours, and we're happy to clarify anything at all. That's a free service we provide to everyone.
That's really reassuring to know. I'll keep the number handy in case I have any questions after I've read everything. Actually, one tiny last question. I've seen some immune-boosting supplements at the front of the store, things like zinc and elderberry extract. Are those worth taking when you already have a cold, or is that more of a prevention thing? I always walk past them and wonder if they actually do anything. I don't want to waste money on something that isn't effective.
Oh, you've picked two very popular ones, and interestingly, they have slightly different evidence bases. Let me give you a quick summary. Zinc lozenges or zinc acetate, not the supplement tablets, but specifically the lozenges, do have some decent research behind them, suggesting they can shorten the duration of a cold if taken within the first 24 hours of symptoms appearing. Timing is key. Since you're already a day and a half in, the benefit might be reduced, but they're not harmful to try. Elderberry extract has some promising early research as well, but the evidence is still limited and inconsistent. It's generally considered safe, but I wouldn't count on it as a guaranteed solution. If you want to experiment, it probably won't hurt, but I wouldn't consider it essential for this particular episode. Your main medicines will do the heavy lifting.
That's a really helpful distinction. I like that you differentiated between the two rather than just saying supplements are all the same. I might skip the elderberry for now since I already have quite a lot to take, but the zinc lozenges are interesting since they can double as throat lozenges anyway. Okay, I think I am genuinely done with my questions now. I promise. I've taken up enough of your time, and I know there are other customers waiting. I feel so much more confident and prepared than when I walked in here an hour ago, not knowing what to buy. You've really made this whole experience so much better than just standing in the aisle reading confusing boxes.
You haven't taken up too much time at all. This is genuinely the best use of my time here at the counter. I want to do a quick summary recap just to make sure you're leaving with everything clear. You've got the daytime multi-symptom medicine every 4 hours as needed, no more than 4 doses in 24 hours taken with food or water. The nighttime formula only at bedtime, and no driving after taking it because of the drowsy effect from the antihistamine. The throat lozenges as needed for throat irritation. The saline nasal spray anytime you feel blocked up. Plenty of rest and fluids, honey tea at home. And remember, if your fever goes above 103, if things get significantly worse after a few days, or if you develop chest pain or trouble breathing, go see a doctor right away. Don't rely on over-the-counter medicine for those signs.
That recap was perfect. Thank you. I've got it all clear in my head now. Daytime medicine, nighttime formula, lozenges, saline spray, rest, fluids, and honey tea, and the warning signs to watch for. I'm going to go gather everything now and then head home to actually rest, which I clearly should have done yesterday instead of pushing through work. If I'm honest, this conversation has also reminded me that I should probably establish a relationship with a primary care doctor, just in case something more serious ever comes up. I've been putting that off for a while, but it seems smart to have someone I can go to when over-the-counter options aren't enough. Does this pharmacy also offer any health services like blood pressure checks or anything like that?
Oh, I'm so glad you mentioned that. Yes. Many pharmacies in the United States, including ours, offer quite a few clinical services beyond just dispensing medicine. We provide free blood pressure checks anytime during business hours. You just need to ask at the counter. We also offer flu shots and other vaccinations, medication therapy management consultations for people who are managing chronic conditions, and diabetes screening. And your instinct about finding a primary care doctor is a really good one. A pharmacist can be a wonderful first point of contact for minor things like today, but having a doctor who knows your full medical history is invaluable for anything more complex. Many health insurance plans in the U.S. cover an annual wellness visit for free, so it might be worth looking into that. A relationship with a doctor is one of the best investments you can make in your long-term health.
I didn't know pharmacies offered that many services. That's actually really useful to know. I've walked past that blood pressure machine near the entrance 100 times and never used it. I might actually stop on my way out and give it a quick check, just for peace of mind. And yes, I'll look into finding a primary care doctor when I'm feeling better. I've been procrastinating on that for honestly 2 years now, and this whole experience is a good reminder that it's just sensible to have that safety net in place. Thank you again, Sandra. Truly, you've been more helpful than I ever expected when I walked through that door today. I came in thinking I'd grab something for a runny nose, and instead, I feel like I have a proper plan for taking care of myself.
That honestly makes me so happy to hear. And it's exactly the kind of feedback that reminds me why I love this job. You know, the phrase we use in healthcare is patient empowerment. And that's what happened here today. You came in not knowing what to buy, and you're leaving with real knowledge about your symptoms, your treatment options, the right dosages, the warning signs to watch for, and even some thoughts about your long-term health habits. That's genuinely empowering. Please do take care of yourself this week. Prioritize that rest. I know office workers always feel guilty about slowing down, but your body genuinely needs it to fight off a virus. Get some good sleep tonight with the nighttime formula. Drink lots of water, have that honey tea, and take it easy. You'll be back to normal before you know it.
I will, I promise. No work emails tonight after 8 p.m., early bedtime with the nighttime formula and a big pot of honey tea. I feel like I have a real recovery plan now, which is a much better feeling than just feeling awful and not knowing what to do. Is there anything else you want me to know before I go? Any final tips or anything I might have forgotten to ask about? I want to make sure I'm really prepared. I realize I've asked quite a lot of questions today, but I'd rather ask too many than not enough, especially when it comes to health.
You haven't asked too many questions at all. Curious patients are the best patients. I think you've covered everything really thoroughly. The only final thing I'd mention is make sure you finish the full period of rest even once you start feeling better. A lot of people take the medicine, feel slightly better after a day or two, and immediately jump back into their full routine. But your immune system is still working hard at that point, and going back to full stress and activity too soon can set you back. Give yourself the full recovery window. Also, be kind to the people around you. Cold viruses are contagious for the first 3 to 4 days, so wash your hands frequently, try to avoid touching your face, and maybe keep a little distance from coworkers until your main symptoms have passed. Being considerate like that is part of being a good community member, especially in a shared office space.
That's such a good point. I actually hadn't thought about the contagious aspect for my coworkers. I was planning to go back to the office tomorrow if I felt a bit better, but maybe I should check with my manager about working from home for one more day just to be safe. I'd feel pretty terrible if I went in and spread this to everyone. We have some colleagues who are older or have young kids at home, and the last thing I want to do is get them sick too. Okay, I really am going to go now. Thank you from the bottom of my heart, Sandra. This has been the most useful pharmacy visit I have ever had by a long shot. You're fantastic at your job.
That is so thoughtful of you. Thinking about your coworkers while you're the one feeling unwell says a lot about your character. Working from home for another day if you can is genuinely the responsible and considerate choice, and your coworkers will thank you for it, even if they never know you made that decision. It was truly my pleasure helping you today, Marcus. You are a wonderfully engaged person to talk to, and I have no doubt you're going to feel much better in a few days with the right care. Take good care of yourself. Feel better soon. And remember, if you have any questions after you've read the labels, or if anything changes with your symptoms and you're not sure what to do, please don't hesitate to come back in or give us a call. We are always here.
Thank you so much, Sandra. I'll definitely remember. Don't hesitate to come back or call. That's a really comforting thing to know. All right, I'm off to find the throat lozenges and the thermometer, and then I'm heading straight home to rest. I feel genuinely better already. Maybe not physically yet, but mentally, I feel prepared and cared for, which honestly makes a big difference when you're not feeling well. Take care, and I hope the rest of your day at the pharmacy goes smoothly. You've already made one customer very happy today.
Thank you. That's so sweet. Enjoy that honey tea, get some sleep, and take those medicines exactly as we discussed. You're going to be just fine. Before you go, just a quick reminder to take a look at the front of the store. We have a display near the checkout with the saline spray and the thermometers right together, so that should save you some hunting around the aisles. The throat lozenges are in aisle 3 on the left side. Have a wonderful recovery, and I hope the next time I see you in here, it's for something much more cheerful than a cold. Maybe just some vitamins or a flu shot in the fall to help prevent all of this next season. Take care, Marcus.
A flu shot in the fall. Noted. That's actually a great idea and something I've been meaning to do for years but keep forgetting about. I'll put a reminder in my phone right now so I don't forget this year. Okay, aisle 3 for the lozenges, front of the store for the thermometer and saline spray. Thank you for that. It really does save the hunting around. Goodbye, Sandra, and thank you again for everything. This was one of those experiences that genuinely changes how you think about something. I'll be a much more informed pharmacy customer from now on. Wish me a speedy recovery.
Wishing you the speediest of recoveries. And just to close things out on a note that might be useful for anyone listening to this conversation, the most important things to remember from today are: always describe your symptoms in detail when asking for pharmacy advice. Ask about dosage and what to avoid. Know the warning signs that mean you need a doctor. Use non-medicated options like saline spray and throat lozenges alongside your main medicine. And never combine medicines without checking the active ingredients for overlaps. Most importantly, don't ever feel shy about asking your pharmacist for help. We are trained healthcare professionals, and we are here specifically to guide you. In the United States, pharmacist consultations like this one are completely free, and we genuinely want to help. Take care, everyone, and feel better soon.